Facebook. Hey guys, we're back with Geno.
How's it going?
This is part 2 of our 2-part series, and we're talking about medicinal massage.
Yes, we are.
You ready?
I am.
Okay, I'm gonna jump right into it.
Okay.
Why do you feel massage therapy is an important component of healthcare?
There are many components of healthcare. There are many practitioners that focus on primary things such as the ear, nose, and throat, such as the feet, such as the skin. And I believe that a massage practitioner fits in well because they are the specialists at the musculoskeletal system when it comes to, manual therapies and soft tissue manipulation.
Awesome. So what's the difference between medicinal massage and other massage modalities?
I believe that the difference between medicinal massage and other modalities would depend on exactly what it is you're looking for. Are you looking to relax? Are you looking to get out of pain? Usually with medicinal massage, there's an underlying thing that we're trying to, either curtail or fix or even prevent. Mm-hmm. So with medicinal massage, you deal with a lot of pain management. And also even when it comes to cancer, just alleviating, the pain and things with massage through that had actually just been really helpful. So depending on the outcome, what you're looking for, whether it's pregnancy massage, whether it's lymphatic drainage, whether it's neuromuscular therapy, they all have their own arena of necessity out there. So medicinal massage definitely does differ from the rest, but everybody has their own plateau.
Great. So that begs the question, what do you practice here at Demaray Chiropractic and Nutrition Center?
Here at Demaray, I practice neuromuscular therapy, or NMT. I also practice trigger point therapy, and I also apply neuromuscular stretching, which is a more intense, hands-on session that allows the patients to more so breathe comfortably and allow the stretching to take place, from myself, the therapist, onto the patient. A lot of these stretches, they can't complete themselves at home. Mm-hmm. So it's usually helpful when you have someone that can coach you through breathing and get to those really tight muscles that you have a difficult time stretching out. And it's been progressive.
Great.
Yes.
Great. So then that begs the question. I love how these just flow right into the other. It's like we practice this or something. How does massage complement chiropractic?
Before I started working with chiropractors, there was a time when people didn't believe in chiropractic care, and it actually took me to work with chiropractors to have a whole different opinion and base it myself. Mm-hmm. And I believe in chiropractic care, and being a medical massage therapist or pain management therapist, working side by side with chiropractors has actually shown me the benefit, especially receiving my own adjustments. I don't have as many doctor's visits, I don't have as many ailments, and I believe that being a pain management therapist in conjunction with chiropractic care, it works because chiropractors work with subluxations of the spinal cord. Mm-hmm. Our entire body is built with muscle. We have more muscle than we do bone. Mm-hmm. So for a chiropractor to work with the spinal column, muscle stronger than bone. If you have a chiropractor that is working with a pain management therapist and they work on the area that the chiropractor plans to adjust, you not only get an easier and less painful adjustment, but it's also going to last longer because the surrounding tissues have been warmed up, and everything's kind of going to fall into place. You're going to have decreased pain, increased range of motion. However, when you're dealing with getting an adjustment without a soft tissue manipulation from a massage therapist such as myself, specifically dealing with those finite areas right, say, between the atlas and the axis.
Which are?
C1 and C2.
Okay.
Absolutely.
So those are the first two?
Yes, first two vertebrae of the cervical spine. A lot of people have tightness in those areas. A lot of people experience migraines and things of that nature. So when I actually am able to go in and I release the pressure in the muscles around those parts, and then Dr. Demaray actually is able to go in, her adjustments go in, they last longer. If there's no soft tissue work done, muscle does have the strength to pull an adjustment in place. Yeah. Pulls it right out of place. And you're making frequent visits to the chiropractor, and you're not really getting much benefit. So,
cool. So, why did you choose medicinal massage over relaxation?
I believe that there are a lot of people that can specialize in relaxation, and I don't think that everyone is able to hone in on the importance of pain management. I chose pain management and medicinal massage because I do enjoy helping people, and from my experience with helping my patients, I increase their quality of life. And I just kind of feel like that's something that relaxation, yes, you're helping people feel better, But with me, I'm making life-changing events occur. You know, people are getting back to doing the things that they do, being active, being able to effectively drive, being able to work. So when I go into medicinal massage, it's because I genuinely, as a healthcare practitioner, I enjoy helping people. And in return, you know, it's just the gratifying sense of someone looking at you and saying, wow, I never knew the power of massage until today.
Yeah,
and, you know, just changing people's lives.
We talk about that a lot, especially with Dr. Demaray. When we talk about philosophy and stuff like that, we like to get down to the root of the problem.
Absolutely.
And not just like cover it up. And I feel like sometimes, well, relaxation massage has its place and it's great. Everybody loves a relaxing massage. Actually getting down in there and getting to the root of the problem and working those trigger points out, or knots, or what have you,
Absolutely.
Really produces that long time benefit. It's not just like, oh man, I feel great tonight because I got that relaxing massage, and then tomorrow you're back at where you were before.
Absolutely.
So.
And I think the big thing with medicinal massage and the type of massage that I do give is a lot of people, when they think of massage, again, they don't think of it as being painful. And my philosophy on pain management is you have to experience some discomfort to get out of pain. So a lot of my patients, when they walk in or when they book, they already know, hey, this isn't a place where you're going to come and fall asleep. You're coming here because there's something that we're looking to fix. Because you have knots in the muscles, therefore you're compressing nerves, and nerves not only innervate other muscles, but they also innervate organs. So when you loosen up those areas and you actually can get really, really deep, more so than relaxation does, you're creating so much more within the body, deep within the body, that is just more than circulation. You're now directly affecting signals from the brain to organs. You're now decreasing muscle tension that is pulling on the back. For example, deeper types of massage and neuromuscular therapy have greater medicinal effects than relaxation.
Okay. So you mentioned when people come in and they book with you, they already know what's going to happen. So what's the most difficult case that you've ever had to deal with?
Being a therapist, it will be 8 years in November. My most difficult case came from a car accident case. I do see a lot of car accident patients. With her car accident case, she was actually hit on the driver's side and thrown into the passenger side. So her entire rib cage was actually shifted up into the right quadrant of her entire back, which of course decreased her ability to turn her neck. It decreased her shoulder range of motion, decreased her overall quality of life. You know, from the waist up, she's extremely stiff. And I think the most difficult part about that was the entire session when she would come to see me was strictly me literally just holding on and applying pressure and pushing her rib cage and centering it again, because in the process of that, it created a scoliosis in her spine. However, although I felt I wasn't doing anything, I was relieving pressure off of her lungs, I was increasing her breathing, and I was actually assisting with pushing and stretching out the muscles and pushing the bones back into place, because as you apply pressure on a certain area for a certain amount of time, signals come from the brain to let the muscles know to relax. As they do that, in conjunction with that continued pressure, you then are able to actually move certain bony landmarks, create space, increase circulation, and of course, decrease pain, stiffness.
Great. So you mentioned circulation a few times, getting stuff to the muscles and away from the muscles. What's the importance of circulation in reducing inflammation, or is inflammation even a bad thing?
Inflammation is actually, it's for me, inflammation is not a good or a bad thing. It's a thing, because it can be good and it could be bad. Inflammation is actually a positive note to let you know that the body is actually, the immune system is actually kicking into gear. Usually when inflammation occurs, there's an area of concern. Sometimes it usually occurs at joints, and circulation directly applies with inflammation, because with increased circulation, you decrease inflammation.
Okay.
Yes.
Yeah.
So
stuff's not getting blocked up.
Absolutely.
And backed up. Yeah.
Absolutely. And that's why a lot of times when, for example, you get a swollen ankle, or you get redness and swelling if you've hurt your knee, that's inflammation letting you know, yes, the immune system is working to try to help create the warmth. There's increased blood flow to that area, and sometimes what you need is to decrease that. So with circulation, venous flow, carrying the blood back to the heart, in assisting with certain strokes, you can actually decrease the inflammation. But having inflammation is not a bad thing. It comes with the territory of having a healthy immune system.
Great. So what are some things then that medical massage can really help with that most people might not know about?
Considering with the type of massage that I've done and the responses that I've received from my patients, they have been able to sleep better, they have been able to comfortably work, they have been able to have decreased anxiety. A lot of people are unaware that with the type of massage that I've learned and that some therapists also practice is they can work on scar tissue from cesarean sections, from surgery.
Mm-hmm.
You know, a lot of people promote cocoa butter. Absolutely, it helps to get rid of scars. However, when you do have a scar, it's a buildup of connective tissue.
Mm-hmm.
And when a therapist gets in there, they can actually break up that connective tissue. They can decrease the look of the scar, and they can actually decrease the coloring that occurs as well, because you're increasing, again, the blood flow and circulation, and now you have it clear it out in the area.
Yeah, that makes sense.
Absolutely.
Great. Thank you, Geno. This has
Thank you.
been super informative. We'll be doing more videos. Geno's going to work on me on, we're going to do some stretching in one video, and then we're working on another video about sciatica. I think that's the stretching video.
Definitely.
And then I got some foot problems. He'll be doing some work and explaining his techniques and stuff in videos to come. We'll be putting another cheat sheet in the doodly-doo down there or up there, wherever the case may be. If you have any questions, always give us a shout out. You can message us on Facebook, leave a comment, like and share the video, and also give us a call at our phone number, which will be in the link, and our email address, which will also be in the thing. Okay?
The doodly dot.
The doodly doo dot top, up, down.
Gotcha.
left,
Okay.
right. Yeah.
Sweet.
Bye, guys.
Have a good one.